Good morning, everybody, and welcome to our first coffee chat for 2021. I am Leanne Swanson, CEO of the National Center for Healthcare Leadership, and I'm very excited so many of you have decided to join us today. I want to start first by having the NCHL team introduce themselves before we dive into today's conversation. Jarrett, you want to go first?
Sure. Hi, everyone. I'm Jarrett Fowler. I am the director of one of NCHL's premier programs, USKIP, or the U.S. Cooperative for International Patient Programs.
Hi, everyone. My name is Callie Lambert, and I am the research manager for NCHL.
Hi, everyone. My name is Melanie Standish, and I am the Leadership Excellence Network's program manager. Soleil, do you want to go next?
Hi, I'm Brady Blanton, and I am the research coordinator for USKIP.
Hi, my name is Ali Ibrahim, and I'm the project manager for NCHL and work primarily on the USKIP program. Thank you for joining us today.
Hi, everyone. I'm Natasha Kazam. I am the program manager for the National Council Administrative Fellowships, also known as NCAF.
Hi, I'm Solid Damawan. I'm an accountant for National Center for Healthcare Leadership. Thank you.
All right, and that is the amazing NCHL team, so thank you all. So in celebration of the National Center for Healthcare Leadership's 20th anniversary, we are hosting these bi-monthly coffee chat sessions to offer a forum for the healthcare community to come together and spend some time conversing with each other and sharing concerns and insights about timely topics impacting. For today's topic, we are going to focus on how NCHL has and continues to address some of the problems impacting healthcare and healthcare leaders. First, I want to start by sharing a little about the history of NCHL and how we have evolved over the past 20 years to meet the needs of healthcare leaders while remaining true to our core principles and values that drive our work and mission. Over the past decade, NCHL has served as a major catalyst in bringing the leadership agenda to the forefront in healthcare by defining competencies that distinguish outstanding performance and advocating competency-based learning. We've established a unique brand with many of our key stakeholders that reinforces our original vision of transformational leadership, team-based interprofessional learning, evidence-based leadership, and cross-industry collaboration. Additionally, we have developed a portfolio of intellectual property, including our Health Leadership Competency Model, our Best Organizations for Leadership Development Award, and other individual and organizational leadership assessment tools and databases that all aim to improve healthcare practices. As I mentioned, this is our 20th year. We were established in 2001 as a direct result of a national summit that found leadership challenges in many areas, including deficiencies in the cost, quality, and patient satisfaction of healthcare, difficulties in attracting young healthcare leaders to fill the pipeline, insufficient attention devoted to professional development, and failures in the advancement of women and underrepresented minorities. Our purpose and work have been guided over the years by these issues because, as you know, even though we have made progress, many of these issues are still impacting us today. NCHL has been a change agent for identifying solutions to many of these issues, as you will hear from today's conversation. Over the years, we have focused our attention on the importance of diversity and culturally competent leadership to drive organizational performance in healthcare through the development of tools, publications, and projects. As we continue to evolve as an organization, our board of directors recently approved our new mission statement to more accurately reflect our vision and focus for the future. And I'm really happy to share our new mission statement with you all today. And that is dedicated to advancing healthcare leadership and organizational excellence by building diverse, inclusive, and collaborative relationships in the US and abroad. Our values remain true to our core principles, which include being the premier source for evidence-based healthcare leadership practices, cultivating communities for peer collaboration across organizations, and collectively developing industry models and benchmarks to improve healthcare. I'm very proud of our rich history and accomplishments, and as you will hear soon from the NCHL team, you will see how we plan to continue to put the knowledge that we have into action to continue to address the unmet and ongoing needs facing healthcare and healthcare leaders today. So I encourage you to join us for these ongoing coffee chat sessions so we all can be part of the discussion and change that is necessary for the continued advancement of healthcare, so that the leadership challenges identified many years ago and those that will continue to arise may be resolved and long-lasting change will occur. I'd now like to turn it over to Melanie, who will lead our discussion for today. Thanks, Melanie.
Thanks so much, Leanne. I apologize if my internet is spotty at any point. This is the world of work nowadays. Again, I'm Melanie Standish. I am the Leadership Excellence Network's Program Manager, and I'm really excited to be, I guess, the debut moderator for our Coffee Chat series today. I do want to take a moment to just describe that today we'll be talking about how the work of the National Center for Healthcare Leadership meets our mission statement, but in the future, we're going to be looking for topics from all of you that we can discuss with various experts, some of our NCHL members. So, the topic's going to be different every time, but we're very excited to be talking about our mission today, which, Leanne, thank you for kicking that off. I did want to briefly restate our mission statement for the good of the group. We have dedicated to advancing healthcare leadership and organizational excellence by building diverse, inclusive, and collaborative relationships in the US and abroad. Now, I kind of wanted to take this moment in this coffee chat series to really break down our mission statement. And we'll go through who are our stakeholders, how are we building collaborative relationships, and then what impact have we made on the healthcare field at large. I'm going to begin with who are our key stakeholders, who is participating, hospitals, health systems, corporate members. Jared, I'm going to turn it over to you real quick. Can you tell us about the work of USKIP and kind of who partakes in these discussions?
Sure, yeah, I'm happy to, thank you. So for the USKIP program, so the U.S. Cooperative for International Patient Programs, it is a consortium and one of the premier programs of NCHL, comprising our core organizational members are about 60 U.S. academic medical centers and health systems located all over the country, all of which have a focus on international, so bringing patients to the U.S. to receive care from abroad, and then working collaboratively with hospitals and governments in other countries to help expand global access to U.S. expertise in high-quality healthcare. In terms of who our stakeholders are, they're varied and I feel like growing by the day. Of course, our core organizational members, but also governmental agencies in the US and internationally. So this could include Department of Commerce, Department of State, even so much as ministries of health, ministries of commerce abroad, non-governmental organizations, for example, bilateral international business councils, as I mentioned, in ministries of all kinds of things, development, commerce, academic institutions, our sponsoring organizations, both for our annual meeting and various things we do throughout the year, our corporate members that have an interest in international healthcare, media and marketing organizations, and quite a bit more. I'm probably not thinking of at the moment, but it continues to grow by the day.
Thanks, Jared. Yeah, I'll mention that USKIP is one of our 3 premier programs at the National Center for Healthcare Leadership, and we look to impact leaders across all spaces. I want to turn it over to Natasha. You work with earlier careerists. Tell us the stakeholders within NCAF and the work that you do.
Yeah, so I think like USKIP, NCAF has quite a few folks involved as well. I mean, essentially the council functions as a bridge between practice and academia. So while we're bringing students and creating this talent pool of recent graduates to the employer who are then building the pipeline, our stakeholders consist of like the graduate students and the programs that they go to, as well as the hospitals and health systems that are employing these early careerists. And as they grow through their career, the fellows, and as they transition out of their fellowship and grow into other leaders, as well as the larger community as a whole. When you look at the fellowship program, these fellows go into hospital and health systems to really learn about how decisions are being made and impacting the larger community. And so it's a wide variety, ranging from like when you're in school to when you're actually down in your leadership career tenure. And so I think with Lens, it's similar, right, Melanie? You guys have several stakeholders on different levels of the hospital.
Yeah, no, absolutely. We, with our leadership excellence networks, we're specifically targeting professionals in like the leadership and organizational development space. So we're really impacting people's human capital functions across the hospital and health system organizations that we work with, from organizations like Johns Hopkins to a Carilion Clinic. We really work with lots of stakeholders. And I think what's really great about Lens is that it's really stayed true to one of our original initiatives when we were founded 20 years ago with NCHL in promoting evidence-based leadership development for healthcare. So our Lens folks really focus on how are we going to best develop healthcare leaders to prepare them for the years ahead, to create effective leadership to help both the health systems that you work in and then your communities, even around that. So we do a lot of work with the learning and development professionals, and it's really exciting to hear what everyone's up to in our community. I would like to mention that over the past couple of years, we've involved some corporate stakeholders as well that have been involved in some of the Lens conversations and such. Leanne, I wanted to pivot to you just to ask quickly, how are we engaging, our corporate members as stakeholders?
Yeah, thanks, Melanie. So as Jarrett mentioned, and all of you have mentioned, similar to how we have our program members, we look for corporate members who are like-minded and share NCHL's core values and work. And we have some great corporate members. We also have annual sponsors, but our corporate members range from like First Group, which is a national search firm, to Herzing University for higher education and learning, and then Flywire, which has a connection to our international patient program, as Jared had mentioned. But how we engage our corporate members is we really want them to engage and connect with our members. So we do that by having them serve on our councils and committees, our program councils and committees, certainly recognition at our annual event, our Human Capital Investment Conference, our Gail Warden Leadership Conference. They've supported our Bold Award, our annual biannual Bold Award. We provide them the opportunity to host and provide informational educational webinars to our program members and the larger healthcare community. And then we also, new this year, are including like listserv postings with featured articles, anything that's informational and educational that would really benefit our program members and kind of have that synergy and connection between our corporate members and program members.
Thanks, Leanne. Yeah, it's been a great experience to get to know our corporate members. And I'll just add that they really embody our own mission and vision. So we're looking for partners all the time who really meet the mission that we've presented today. I do want to pivot within our mission to the collaborative relationships piece, and speaking to some of the projects, about how we build collaborative relationships within the healthcare industry. I want to go back to you, Skip's work, and Jarrett, can you tell us about the telemedicine project? I think that's a really exciting one to highlight.
Yeah, definitely. So telemedicine in the United States, of course, has been a very hot topic this year. The regulations and regulatory environment all over the United States has changed quite a bit by necessity. Of course, we've had to kind of pivot to telemedicine and remote second opinions, I think, this year more than ever. But even prior to the pandemic, so in 2019, USKIP launched an initiative that was focused on conducting legal due diligence related to the cross-border delivery of international telemedicine and remote second opinion. So This would be for example, a US doctor providing distance health services to someone in Chile or Argentina or wherever it might be. And so unfortunately, the cost for having local counsel evaluate these sort of regulatory environments related to the cross-border delivery of telemedicine and remote second opinions in a new country or new jurisdiction can be very high, sometimes $15,000 to $20,000 or more for a single market. And given the significant fees that have been required to commission this kind of work, USKIP's members, they encouraged us to help them develop a mechanism that would allow for the hospitals to share in the costs of conducting legal assessments regarding the delivery of telemedicine and remote second opinions in high interest markets, because it's something that everyone was interested in. And therefore they thought, why don't we try to pool our resources together to try to get some of this work done? So this would enable USKIP members to complete a large amount of their legal due diligence process and work for numerous countries at once at a substantial discount versus what it would have costed them alone as a single institution. So, and in doing this, it's to date, this has allowed us to help the hospitals get 24 separate market analyses done for remote second opinions in telemedicine in other countries in a year that I think it's been really needed more than ever, when, of course, patients may not be able to travel to the US, and we really had to pivot quite a bit to trying to scale up these international telemedicine programs at hospitals across the United States.
That's great. Thanks, Jarrett. I'll mention that I think with the COVID-19 pandemic, we've really seen how these collaborative relationships within NCHL have come to fruition and kind of showed their importance, like now more than ever, in a sense, especially with your telemedicine work. I do want to pivot over to Natasha with NCAF and your collaborative relationships. I know you work with quite a few different organizations, including your members and maybe some like external bodies and such. Would you like to speak to maybe some of either the data sharing that you do or anything related to the collaborative relationships that you create?
Yeah, so at NCHL, we're all about peer-to-peer learning, and that's very evident in NCAF as well, because we're all working together to advance early careerists and to really build a diverse pipeline of leaders, young leaders that are coming into healthcare. So we have 117 members that are comprised of hospitals, health systems, and graduate programs really working together to accomplish this. And we work with some of the industry leaders like AUPHA and ACHE and CAMI to really make sure that both sides are kind of well accounted for and students are prepared for these fellowships, and the fellowships are kind of ensuring that things that they've learned in their graduate programs are translating into the real sort of workforce. I think that given the pandemic, we've been collecting data. NCAF is a newer program. It started in 2016. So since inception, we've been collecting data. But last year, our collaborative sort of peer-to-peer learning really came into play as fellowships were kind of going through this rocky time of how many positions really will be offered. And with sort of our relationships and our members, we were able to ensure that like 72% of the hospitals and health systems offering these fellowships were doing so in a standardized manner. And they were sort of keeping this program for early careerists and young leaders going, and really share with one another of how are we going to go from sort of in-person interviews and internships into a virtual environment and really onboard our fellows to ensure that they get the full sort of light of what would happen in person if they were meeting with the CEO and going to do this interview in person. So a lot of learning going on with one another, and we're always looking for other ways to partner with industry leaders to continue to pave the way. I think, Melanie, does Lens do something similar too? I know there's a lot of collaboration going on over there as well.
Yeah, I spoke to our members and, the leadership development, organizational development space. And something I wanted to highlight was just the opportunity for peer-to-peer networking really stands out amongst all of our programs. And every year when we do our Lens engagement survey, that the the consistent value add that we hear from our members is we love collaborating with peer-to-peer networking. If we think about like the NCHL Competency Model, one of our domains is boundary spanning. Like, how are we reaching across organizations in order to make an impact? And so I think Lens really offers that. One of the examples I'll quickly highlight related to like our response to COVID-19 in March, when the pandemic really started hitting the US, our members said we really ought to get together and talk about how COVID-19 is impacting our human capital challenges. So we had weekly COVID calls on Fridays where any members who wanted to join could, and just really talked through, what are you facing right now? What's going on? And then we put together a Powering Our People guide that really spoke to different human capital challenges that were going on in the field at the time. Things from how do you restaff people, how do you upskill people, how do you respond to people who might need childcare, who might need a place to stay, because at that time we needed healthcare workers to isolate potentially from their families. So we put that publicly facing document on our website, and we really just opened up this opportunity for our members to come and join together to tackle these challenges. So it really just kind of spoke to the importance of having these networks and boundary spanning. I do want to say that we've been largely talking about our programs in silos, right? USKIP, NCAF, Lens. Really for this 2021 year and our 20th anniversary, we're trying to impact the broader healthcare community, expand across the aisle, across programs. And one of the things we recently launched was our mentorship program. Alia, you've really taken the lead on that. I'd love for you to speak to that real quick.
Yes, thanks, Melanie. So as you mentioned, in celebration of NCHL and our new mission, we wanted to enhance our engagement with the healthcare community and find new ways to accomplish our mission. As you mentioned, our mission is building bridges, connecting like-minded individuals in the healthcare community. So given our focus on healthcare leadership, it felt like a mentorship program was actually long overdue. So we piloted this with a small group in USKIP, and it was a huge success. And so I'm happy to announce that last week we opened the call for applications for mentors and mentees, and we currently have about 75 applications. So it's been a great response. And we're actually seeking more mentors. So if you are interested in advancing the future and leadership of healthcare in the healthcare leaders in the community, we encourage you to apply. And we're happy to follow up and send more information about that after the call too. So thanks for mentioning that, Melanie.
Yeah, of course. We've been really excited to see all the applicants come through and see how many more people we can impact in the field through mentorship. We have a little bit of time left, and I wanted to talk about how does the National Center for Healthcare Leadership address problems that our members and stakeholders bring up, and how do we advance like leadership and organizational excellence? And Alia, I'm actually going to turn it right back over to you. And can you talk a little bit about USKIP and the patient experience program and how that was kind of like a problem that you looked to address?
Sure. So USKIP members identified an industry gap in patient surveys since international patients with a foreign address are exempted from CMS requirements to be given patient surveys in the same manner as patients with US addresses. So we worked with USKIP members to launch the USKIP International Patient Survey Initiative, which saw the development of basically the first and only standardized survey designed specifically for international patients that have traveled to the US for medical care. And that can be administered at hospitals across the US. So we're entering our third year in the initiative, and the initiative has allowed for operational insights through data collected by patients, from patients, and this can be analyzed longitudinally within their organization, and also it can be benchmarked with other organizations. So we continue to facilitate and foster this by hosting monthly committee meetings and also reevaluating survey methodologies designed specifically for international patients.
Great, thanks so much for highlighting that. I want to talk about Natasha's work with NAFCAS and how that kind of filled the need. Could you speak to that a little bit?
Yeah, thank you, Melanie. So, I mean, fellowships have been around for decades, and I think when NCAF was formed, one of the larger problems we were seeing was that there was no standardization process for students applying to fellowships and how sites were recruiting. A student would start a graduate program and within, the first 6 months or so be, told, hey, if you want a fellowship, then you have to apply now. And to be asked to do something when you're just learning the curriculum and have a job, maybe 2 years out, can be quite difficult for a student. So we really wanted to make this a transparent process for students to be able to make a decision that works for themselves, and for fellowship sites to be able to get that national visibility and be recruiting from across the country to really diversify their pipeline and ensure that they're finding the right fit, as well as, kind of making it competitive, but in a more, in a manner where it's standard. So it's a standard competitiveness. Everyone follows the same application dates. Everyone follows the same offer acceptance dates. And, we really filled the gap with centralizing this through an application. Over every year, we're getting, 1,000+ applicants, and it's to fill, anywhere from 150 to 180 positions. So it's really a great way that's helped students kind of learn more about fellowships and become aware of these leadership opportunities early on in their career. And for fellowship sites, it's a great one-stop shop to build their talent pipeline and get the recognition on a national level with other quality programs that are offering the same opportunities. So it's been great, and we're, going into our 6th year now. And I think, recognition is really important to all of our members and all healthcare leaders alike. Everyone's doing such unique things, and NCHL is always trying to highlight that. Melanie, can you speak a little bit about, BOLD and the competency model and what the Lens organization is doing?
Yeah, thanks, Natasha. I definitely can. One of the things when I think about our competency model in BOLD is I think about the what and the how of leadership. So like, what should leadership look like? And then how do we develop leaders to be those things? So our competency model is a series of competencies. Again, this is a publicly facing document that you can request. It's requested by seriously thousands of people every year across many different people, from professionals looking to develop themselves to health systems looking to develop like a leadership performance appraisal system. So it really is an evidence-based model to define what effective leadership looks like in healthcare. And then when we think about how do we develop leaders, our Best Organizations for Leadership Development program, which runs every 2 years, assesses and benchmarks organizations and their leadership development strategies. So how are you going about developing your leaders, and how does that compare to the evidence base on how to develop leaders based on best practices? So we kind of pull from the organizational psychology literature, the management literature to kind of inform this benchmark data set. And it really is the only data set that I know of that covers best practices in leadership development across organizations at the organizational level. So it's really a great asset that NCHL has. I do want to take this time to wrap up the conversation. We might have time for a question. So if you want to go to the Q&A real quick, I can monitor that. But I want to thank everyone for joining us today, and just briefly mention that we're looking to celebrate our 20th anniversary moving forward through this year by continuing to dedicate ourselves to leadership and organizational excellence, by building diverse, inclusive, and collaborative relationships in the U.S. and abroad, just to repeat our mission statement. So we look forward to continuing to offering more publicly facing opportunities so that whether or not you're a member of one of our premier programs or just someone who's interested in NCHL's work, you can continue to participate with us. Let's see, I guess we have 1 minute left, and one question we did get through the NCHL info email was, what else are we doing for our 30th anniversary? Leanne, do you want to mention really quick some of the things that we're doing? Or 20th, I said
20th. I was like, you just aged us by 10 years. Yeah, first I just want to thank everybody for joining us, like you mentioned, Melanie. So we actually have some great things lined up for this year's celebration, and these are just what we have lined up now, but certainly stay tuned for some more exciting things. Obviously the coffee chats, so these will be again bi-monthly, so please plan to join us every other month at the same time for these brief chats. I'm excited to let you know that we're also going to be launching some NCHL town halls. We plan to do 3 of those this year. And these are designed to be more outwardly facing, in-depth conversations, more like a fireside chat, a deeper dive into critical topics, looking to have leading experts come in and share their expertise to address these topics. So stay tuned for the town halls that we'll be launching. I'm also pleased to announce that we're going to be, I think for maybe the first time, producing an annual impact report later this year, which will highlight NCHL's accomplishments and contributions to healthcare and healthcare leadership. We are revising our website, so we're excited to roll out our new website. And last but not least, fingers crossed, we hope to be able to meet in person this year at our annual Human Capital Investment Conference and our Gail Warden Leadership Excellence Award celebration that's scheduled for November 15th through 17th in Chicago. So we obviously held it virtually last year, but we really hope with everything that's progressing that we'll be able to come together in person and have like a true 20th year celebration at that event. So stay tuned for more details. Join us on social media. You'll be able to hear about all of our offerings this year and look forward to you joining us for all of these great conversations.
Thanks, Leanne. I think we're hoping in this next year to kind of work towards what we could even achieve in our 30th year. So to tie back my mistake there, imagine what we could achieve by the time we're celebrating our 30th anniversary. I do want to conclude really quick just by sharing my screen and taking a look at the next coffee chat will be on Thursday, March 25th at 11:30 a.m. Eastern. Again, we're looking to talk about a variety of different topics on these coffee chats. So submit topic ideas and questions to info@nchl.org. And we look forward to seeing you next time. On behalf of NCHL, have a great day, everyone.
Thanks, everyone. Bye-bye.